All right, let's talk about the knee. So I've had a couple questions come up just in the past couple days, and a couple clinical situations. One is for an athlete, knows they have a slight cartilage defect in their knee, which is producing a certain amount of pain with impact, particularly with certain jumping movements, and when they get to a certain degree with squatting. And they already know about regenerative medicine, and so if this is you, this is a good topic. The idea here is they want to wait a little bit until they can go ahead and do a series of regenerative injections that I would design. So what can be done in their interim, waiting, let's say 2, 3, 4 months for whatever reason, right? It could be traveling, could be you've got some events coming up, could be that life is just way too busy and you just can't take the time off. So the question was, is it okay to go ahead and do a steroid injection and then wait and do the regenerative techniques? And this is something that comes up pretty often. I see a lot of folks who've had a steroid injection. They're coming to see me because it didn't work. They're still having pain. Just so you know, if you do have a steroid injection, you are going to have to wait a certain amount of time for that steroid to wash out of your system, because I need your body to use its inflammatory pathways to help with the healing process. And steroids are very good at reducing inflammation, which oftentimes helps with pain, but it doesn't help you heal. So what I suggested, and let's kind of go through some of the spectrum of regenerative injections that are available in place of potentially getting a steroid injection. And why is it that I am steering you away necessarily, or steering you away from a steroid injection? Steroids have their place. They are very good for, like I said, reducing inflammation, but some people, if they get a steroid injection, it can damage your chondrocytes. These are the cells that help make up your cartilage. For some people, the steroid injection can help weaken your ligaments and tendons. That's not what you want, especially if your knee is already in pain, or if you have moderate to severe arthritis. It can, yes, help with the short term, but I'm thinking in terms of the long term. I want your knee not only to feel better, but ideally we want to prepare it so that your knee has a chance of ideally regenerating certain tissues, or at least not degrading more or accelerating the degradation. So ozone therapy. Ozone therapy is something that works well for certain folks. It can help reduce inflammation. Ozone therapy is old. I mean, it's something that's been in use since the early 1900s. You could also try prolotherapy. Prolotherapy has been around for 6 or 7 decades now. It's been practiced in different ways, but when it's practiced correctly, it can be very safe. It can help reduce not only pain and inflammation, but it can help stimulate your body to help with the repair process and lay down collagen. It might not be the exact same type of collagen or the same structure, but it can help tissues start to repair themselves. Now, something that is off-label is BPC, the peptide, BPC and TB500, also known as Wolverine. Those can be used. You can use that subcutaneous. You can use that around the knee to help with certain amounts of pain. Off-label use, you could also inject BPC into the joint. I would suggest you're doing this with your physician under their care. And again, that is off label. So now we're getting more into the experimental realm. And then going further with the experimental realm, now we're looking at exosomes, stem cells, PRP. So people have been injecting PRP for quite a number of years now. So if you are of a certain age, I think PRP could work very well. Once you get up in certain decades, 50s, 60s, I start to question whether or not the PRP is going to be as helpful. It probably is still going to be helpful, but as far as getting the most bang for your buck, you're probably looking more so at exosomes. You're looking at extracellular matrix potentially, and you're looking at mesenchymal stem cells. There's other types of stem cells that could also work well, but those are the ones, that's kind of the spectrum that I would suggest you look at now. And another one came up, which could be offered through your insurance, which is hyaluronic acid. Now, hyaluronic acid, some people know it as the rooster comb. It is, I would say, flip a coin. It works for about 50% of people. If it works for you, great. It's going to buy you time. If you can combine that with something like PRP or exosomes or stem cells, you're probably going to make it go a lot further. But for a lot of people now, they have to pay out of pocket for the hyaluronic acid. So if it's not something that works for you, or if you're trying it for the first time, I almost feel like telling you it might be better to put your money towards something like PRP, prolotherapy, potentially exosomes or extracellular matrix. But again, these are off-label uses. These aren't uses that are approved right now, but they're showing a fairly good track record as far as helping people with pain, with inflammation, and giving them the relief that they want for their knee and for other joints. Okay, so I hope that's helpful. Just giving you something to think about as far as other therapies, other treatments, some that are approved, some that are off label that can be used for your knee. All right, we'll talk soon. Bye-bye.